Cassie, if you want to get people fired up, what you do is you take like a handful of people to practice in a Lyme endemic area. Maybe if you're really evil, you'll throw in some internists. You'll throw in some of the College of Veterinary Internal Medicine into this group. And then you say, what's the right protocol for a Lyme positive asymptomatic dog? And I'm going to tell you two things. Number one, you're not going to get an answer. You're going to get answers.
Welcome, VetFolio Voice listeners. Thrilled to have you here for this conversation. This one is sponsored by Elanco, and in it, I was joined by Dr. Matthew Eberts to talk about Lyme disease. Now, I've said it many times, but it bears repeating that anytime we get into parasites and vector-borne diseases, I always find these talks a little bit intimidating. I mean, parasites and ticks in particular are incredibly clever, and I'm always fascinated by and definitely intimidated by all the different ways they manage to kind of outwit our defenses and transmit these vector-borne diseases. Dr. Eberts, however, feels quite differently from me about it. He really enjoys talking about this topic, and truth be told, he made me enjoy talking about this topic and made it feel a little bit less scary. Really, if I'm going to talk to anybody about parasites and vector-borne diseases, he was so much fun, and I learned a ton from listening to him. In this conversation, like I said, we talk about Lyme disease. So we cover geography and how the geography of Lyme disease is changing. And I know for me, I had a general sense of the changing geography of vector-borne diseases prior to this conversation, but Dr. Eberts added a lot more context to that part of the conversation. That was one area where I really took a lot away. We also talked about transmission, and Lyme disease is one of those complicated diseases, but Dr. Eberts does a great job of breaking down some of that more complex physiology in a way that made it really understandable. And of course, that led into talking about prevention, including oral tick preventatives, as well as vaccines against Lyme disease. So much information in this episode. Some of it is really complex, but again, Dr. Eberts was wonderful, so charismatic and educational. Again, I learned so much, so I hope everybody listening feels the same way. Let me tell you about him, and we will get into it. Dr. Matt Eberts is an Elanco Regional Consulting Veterinarian for companion animals. He received his DVM in 1999 from The Ohio State University and completed an internship at the University of Minnesota Teaching Hospital. He moved to Brainerd, Minnesota to work at Lakeland Veterinary Hospital, becoming medical director and co-owner. The Northwoods of Minnesota is a hotspot for tick infections, and managing tick-transmitted disease is a pillar of practice. Matt became involved in research regarding managing and diagnosing tick-borne infections, leading to multiple publications and academic presentations. He joined the team at Elanco Animal Health in 2016. All right, let's talk about Lyme disease.
Join more than 100,000 learners just like you. VetFolio is one of the largest providers of continuing education for the animal health community, offering more than 500 RACE-approved CE courses. Earn veterinary CE anytime, anywhere with VetFolio. Subscribe today at vetfolio.com.
Well, hello, everybody. Welcome back. I'm here with Dr. Matthew Ebert, and we're going to talk a little bit about Lyme disease. Dr. Eberts, you and I have chatted a little bit in the past, and I've had such a good time talking to you, even though we're talking about parasites, which I've said many times always gives me a little bit of the heebie-jeebies, not because of anything. I think we've talked about this before. It's because of how clever I feel like they are. And Lyme disease certainly falls into that category. So I'm excited to jump into this with you to learn more. Knowledge is power, right? Then we can combat Lyme disease more effectively.
Yeah, I hate to break this to you, Cassie, but you have made a horrible mistake talking to me about Lyme disease, because it's one of my most favorite subjects. And because of what you nailed, every time I think I'm smart, just start looking at tick diseases and you'll realize how much we don't know and the complexity. So this is one that just encapsulates the whole nine yards.
Yes. Always like a little bit of a dose of humility that comes in once we start talking about tick-borne diseases.
And being up in the state of Minnesota, I grew up in Columbus, Ohio. So we really, at the time I grew up back in the dark ages, because I'm so old now, at the time we grew up, it really wasn't an issue in Central Ohio. Now that's changed. And then I moved to Minnesota, and boy, it was an eye-opening experience. The depth of the tick diseases that we have in the upper Midwest.
Sure. And I can relate to that a little bit. Being in the Southeast, we certainly have our fair share of tick-borne diseases, but Lyme in particular is not high on the list. But kind of what you're describing, this is changing over time. So I'm glad we're going to get into it. We're going to learn more, and that way we can hopefully, try to keep our pets safe and create awareness of what we need to be doing in this space.
Absolutely, and we got some really good tools available for dogs. So it's not too bad to be a dog in the world of Lyme because we have a lot of options that we can jump into.
Absolutely, absolutely. So, thinking of being in the Southeast, we see a fair bit of Ehrlichia, a fair bit of Anaplasma, not a whole lot of Lyme disease. So when we're thinking about tick-borne diseases, what is unique about Lyme disease specifically?
There's a number of things, and first and foremost, the vector of Lyme disease is the primary vector in the eastern part of the U.S. and the upper Midwest is Ixodes scapularis, or the black-legged tick. Now, this tick has very specific wants in life, and what it doesn't want is Florida heat. So it is a cold adapted tick. So we do see some geographic patterns with it that fits with the temperature range that this tick prefers to quest at. And the interesting thing is you have Ixodes scapularis in Florida. You do. You can go out and
We
find them.
do.
But the problem is they would do what I would do in Florida is wither in the heat. They do not like that high temperature. So when they quest, when they seek things to feed on, they usually do it under the leaf litter. So the animals they get exposed to in some of the southern regions where there's pockets of them are different than the animals they get exposed to up in like Minnesota, Wisconsin, where the temperature is more favorable to their wants. And they'll go higher in their questing, so they'll get exposed to more mammals. In the southern part, and we see this in California too, with the Ixodes pacificus tick, which is the vector of Lyme disease on the West Coast. We see this as a lot of their early meals are with lizards.
Huh.
Lizards don't carry Lyme disease.
I don't think I've ever seen a lizard with a tick on it. Now I'm going to pay a little closer attention.
And the key is, okay, so
And
the
we see a
cool
lot of
thing,
lizards down here. There's a whole bunch of those.
right? The cool thing is Ixodes species ticks are not born with Lyme. Okay, they're born clean of Lyme. They're pure in the world of Lyme. They actually get infected with it in their first or second meal. And this is really relevant because we think about the tick life cycle. Okay, we got egg, we've got larva, we've got nymph, we got adult. Each one of those life cycles, the larva, nymph, and adult, take one blood meal. Now, the larva typically like smaller critters. So they'll be feeding on primarily, especially in the upper Midwest, rodents. And the primary vector of Lyme disease, the source of it is rodents, specifically species of mice, but we can kind of see it in other rodents. So that's that first meal they take is a lot of times the meal that dooms them, that gives them the Borrelia bacteria. Now, if your first meal is a little lizard that's running around in the leaf litter, you're not going to get it. Lizard blood doesn't carry Lyme. In fact, lizard blood hates Lyme and it actually has some anti-Lyme properties. So that first meal is important. So just the life cycle of the vector is really unique. The second thing is the bacteria itself. The bacteria itself, that Borrelia burgdorferi bacteria. Now, I say Borrelia burgdorferi. Now, one thing that microbiologists love to do is rename everything. About
Sure.
every so often, we got to get a new name. So there is some reclassification of this family of bacteria that has happened recently. But I'm old, so I'm going to use the name that's on all of our products and everything like that too. I'm not going to say Borrelia. I'm going to say Borrelia burgdorferi. So just just for trivia's
This
sake.
is all, yeah, news to me. Like I would have said Borrelia burgdorferi. Yeah, the new naming is news to me.
Yeah, I'm not a fan. But anyway, that's neither here nor there. So basically, what this bacteria does is it has such tremendous variation of its outer surface protein. So to understand the Lyme story, you need to understand the outer surface protein story, or OSP, as we kind of abbreviate it. And the key is those outer surface proteins, and there's hundreds and hundreds and hundreds of different outer surface proteins. But the thing is, not only is there a complex number of outer surface proteins, but what this bacteria does is it changes its protein codes at different stages and different areas of its infection life cycle. So what it wears in the tick as an outer surface protein coat and what it wears in a mammal are two completely different things. And even that extends to if we're going to try to culture Borrelia in the laboratory, what it does in the laboratory is completely different than what it does in different hosts in Mother Nature. And this is really critical because that gives it Lyme two things. The first thing that that tremendous variation does is it gives the Lyme a strategy to evade immune destruction. Lyme is the master of chronic subclinical infection. So what we know from studies in dogs is once you infect a dog with Borrelia, the two things I can tell you what these studies show consistently is number one, those bacteria stay in the system for long periods of time. And when I say stay in the system, not only can they be detected by PCR testing, but they can also be cultured months down the road. And the second thing is with that variation of the outer surface protein, it just doesn't, it's very good at hiding from that immune response. So once you get it into the system, it's really hard to get out. Your immune system's not great at doing it. And the other thing that makes it a challenge too is the bacteria likes to hide. It can evade not only the immune destruction, but it can also evade antimicrobial treatment. So in some of these dog studies where you infect them, then you treat them, some of those dogs never clear the infection, even with appropriate treatment. So those are some challenging things at that. And it's that chronic subclinical infection that's our challenge for the dogs that get infected with that.
Well, I think we can wrap up the podcast right there because I just learned so much just from that one question that there's so much to this transmission, this bacteria, which we know that, and it sounds like as we continue to learn more, we discover even more clever things about this bacteria and the way that it can evade host immune response. I do love hearing that it doesn't like lizard blood or the Florida heat. That's, a little silver lining there for me. I wanted to ask you, when you're talking about this bacteria staying in the body and being detectable for months and months and months. So what I understand is that when we do, say an antibody test for Lyme disease, that eventually that antibody test should go negative. It shouldn't, it's not like Ehrlichia anaplasma where it's going to stay that way. And I see you shaking your head.
Unfortunately, not true.
Okay.
Another cool thing is our tools in veterinary medicine to diagnose infection. When I first moved up to Minnesota and started practicing, we didn't have these tools. Our best test for Lyme disease was a Western blot antibody analysis. And those were complicated. Those were very expensive. They had a long turnaround time. And sometimes they came back with equivocal results. So it wasn't a good diagnostic test for clinical utility. That's changed. And it's changed again. This is why we got to understand that outer surface protein game. There's a specific outer surface protein and the naming of these outer surface proteins is goofy. So I apologize when I'm throwing out all these names and numbers and stuff like that. But the outer surface protein that interests us is one called VLSE. VLSE is a specific outer surface protein that's expressed when that Borrelia is in a mammal. So it doesn't express in culture. It doesn't express in a tick, but when it gets into a mammal, somehow that little twisted bacteria knows where it's at, and that protein becomes expressed on the outer surface. Now, it takes a few weeks in general for that to happen. Now, that single outer surface, so we're talking about one of like 1,000. One of those outer surface proteins, that single outer surface protein, has tremendous variability. It reshuffles itself to change its appearance continuously. So again, that's the strategy to avoid immune destruction. One of those segments of that outer surface protein is conserved. Call it the IR6. And if your dog develops an antibody to that target, that specific target on that VLSE protein, what we can say is number one, that that dog got exposed to Borrelia. And number two, that Borrelia existed in that dog for the weeks it took for that viable bacteria to express that protein and start going through the cycle. So when we're running those in-clinic tests, which revolutionized it, it's very specific to that target. That's the target that that test shows me. It's an antibody to that specific area. So I know the dog got exposed. You're not going to get that from vaccination with wholesale vaccines or anything. It's going to come from the natural source. I know it's been infected, so I know a tick got through and bit for a significant amount of time. And I also know that that bacteria is probably going to be in there long term. So, in my clinical experience, when we first started screening with our in-clinic screening tests, 45% of the dogs that walked in my practice had a positive Lyme test. And that really opened up my eyes. And in my experience, the majority of those, if we do nothing, that test, that in-clinic test, that blue dot or whatever you're looking at, is going to stay positive for the rest of that dog's life. That's my experience if there's no intervention done. Now, could some dogs clear it? Yes, it's not the norm in my experience. Now, what I did find as we started using these tests is if I had a dog that I treated with antibiotics, about 60% of those dogs would actually clear the in-clinic test, but it took about 2 to 3 years.
Okay, okay. And I think that's probably what I'm thinking about then, because as you can tell, I thankfully don't have a ton of clinical experience with Lyme due to geography and things. And so I think that was kind of the conversation I've had in the past is that this will go negative eventually after 2 to 3 years. But you're saying that's with antibiotic intervention,
Correct.
and it's going to take quite a while. Um,
Yep.
and meanwhile, we're detecting this bacteria the whole time if we were to test specifically for Borrelia.
Yeah, I mean, if we extrapolate what we see at the laboratory with dogs, if we were to take those client-owned dogs and actually collect skin biopsies and culture them, and we've had no intervention whatsoever. We've let the bacteria do its thing, we let the immune system do its thing, then I'm going to bet money that that dog will culture positive.
Okay, okay. That really, I feel like that kind of brings the antibody conversation full circle for me because I went, I was going, how does vaccine play in? And supposedly these go negative, but all of this, all of these pieces like I said, we could just wrap up right here. I'm learning so much just here, and I don't even know how long we've been talking because everything is really interesting. Once again, proving how clever not only ticks, but this bacteria in particular is. You've touched on this a little bit in terms of what these subclinical infections, chronic subclinical infections, and things like that. But certainly we get clinical disease as well. So when we're talking about Borrelia transmission, once it's within the body, once it's within the dog, what does it do when it's in the body?
One thing I failed to address for your question, because again, I go down rabbit holes when I'm talking
They're
about
fascinating
this
rabbit holes. Like I
disease.
don't know if you can see my face over here. I'm like, wait, tell me more.
I want to revisit what it's doing in the tick. So when it's in that tick, when it's in that Ixodes species tick, it wears a very specific outer surface protein coat. So there's a lot of players in it, but one of the major players is a specific outer surface protein called OSPA. Now, OSPA does two things. Number one is it allows that bacteria to colonize the tick guts and it allows it to adhere. So OSPE is one of the critical players. Now I say players, I'm reducing this down to a very simple story. Lyme is not simple, but this is an easy way for us to kind of understand where our steps of intervention can happen. But OSPE lets it sit in that tick gut. Now, just sits there. It's all happy and dandy. It's not doing much until that tick takes a blood meal. When that tick takes a blood meal and starts bringing mammalian blood into its hindgut, that bacteria changes. The change in temperature, the change in the environment, it knows that tick is feeding and it's going to do something about it. So what happens is that OSPA downregulates. So it drops the OSPA along with others. Again, this is a much more complex story, but we're going to use OSPA as kind of our model. It's going to downregulate, and then other outer surface proteins are going to upregulate. Now, that downregulation of OSPA in general is about a 24, 48 hour window is kind of that window. And I want you to keep in mind 24, 48 hours because that's a really, really critical window. That's the window where there will be changes in the outer surface protein coat for the Borrelia. It'll drop from the hindgut and then move to the salivary glands of the tick. Now, in order to get to the salivary glands of the tick, another outer surface protein is one of many, but is critical, is that one's OSPC. So OSPC allows it to go to the salivary gland and allows it to go from the salivary gland into the host, into the dog. So those two you'll hear a lot about. OSPA, which has a 24, 48-hour window once the meal starts, and OSPC, which allows that to go from gut, salivary gland, into the dog. And it'll wear that OSPC for a while in the dog, but then it'll eventually ditch that and go to other outer surface proteins. So once it's in the dog, it loves to, and dogs are pretty unique in terms of Lyme infection because they're chronic. There's only chronic ramifications of it. Dogs do not appear to get the acute Lyme disease, get sick within, 10 to 14 days, like we can see with other tick infections like anaplasmosis or lichiosis. It's strictly a chronic player. And what happens during that chronic phase is literally it's corkscrewing through the connective tissues. And it corks through the connective tissues. It really likes to be around joint tissues. It really likes to be around nerve tissues. And it's just slowly disseminating throughout the dog. So it starts at that site of the tick bite, then it disseminates. And so what this means is it's a very quiet infection. The bacteria is doing everything it can to evade immune destruction. And most of the dogs that you test for Lyme are going to appear clinically normal. Okay. They're not going to be sick. They're not going to have signs. Now, some will. And if a dog gets clinical signs, typically what we see in dogs is swollen joints, fever, lethargy. That's kind of the classic Lyme disease signs. But that's not going to happen until months after the tick bite. But even in those subclinical dogs, okay, we're like, okay, this dog's not sick. Really? Really? Do we know that? And again, we jump to those laboratory studies in dogs. And in laboratory studies with dogs, if I infect a dog with Lyme, most of those dogs in those infection studies never get sick. They're acting like normal laboratory dogs, wagging their tails, having a good old time. But if you biopsy them, specifically looking at the nerves and the joints, most of those dogs will have significant histologic inflammation at the level of the joint, at the level of the nerve that we don't see in dogs that aren't infected. And the other interesting thing about that subclinical inflammation is if you treat those dogs, even if they're not symptomatic, you treat those dogs with antibiotics. And again, we know this from these laboratory studies. Most of those dogs, that inflammation resolves following antibiotic treatment. So again, more evidence that that bacteria may be quiet, but is it quiet as we think it is? And the problem with that is we have the classic Lyme disease signs, with the swollen joints, and that's kind of what we see. And that's a good disease to have if you're a veterinarian, because the dogs come in profoundly ill. The owners are like, oh my gosh, Max is really sick from this. You diagnose it and you put him on antibiotics, you got a different dog in 48 hours. So it makes you look really good. And the thing is with Lyme disease, another thing I found clinically in my practice experience is that stupid things cause a dog to get clinical. So this dog may have been infected months, maybe years ago. Who knows? It's fine. It's not showing clinical signs. But when something happens to the dog to stress it either positively or negatively, and I saw this all the time with people coming up. I live in Brainerd, Minnesota, which is a vacation spot. There's a lot of tourism up here because we have so many darn lakes. You can't throw a rock without it landing in a lake. So people like to come up here and do outdoor activities. They like to hike. They go on the lakes. They like to camp. And a lot of times they'll bring their dogs. And the dog comes up here, it's excited, it's running around, it's having the time of its life, then it won't walk.
Huh.
And they bring it in to see me. And so this dog was infected with Lyme, and then it was not relevant clinically until it was. And a lot of times, stressful situations, and it doesn't have to be a bad stress. It could be a fun stress. It could be a good stress. I had just seen all sorts of things where I can look back and say, aha, that change in that dog's life triggered the clinical signs to come on.
That paints a picture in terms of when and how to look for this. I appreciate what you said about, this perception of subclinical, because I wonder about that with a lot of different inflammatory disease processes of like they're subclinical, but I agree with you. I'm like, are they though, or are they just dogs and they're just happy and they're tough and they're not going to tell us that they're hurting because, whatever treat I have in my hand is way more exciting than whatever they're feeling in their joints or whatever it may be. Such an important point to make. And I don't know that that would have been on my radar either of, a dog who has been, quote unquote, subclinical for Lyme disease and then all of a sudden can't walk. I don't know that I would have made the connection. I think I would have said, but this dog's been fine. Why is it all of a sudden flaring now? Um, really important questions to ask in the history taking when we're seeing these patients of, what have you been up to? Did you go on an exciting hike through the lakes of Minnesota? And can you hear the Midwestern in my voice? I'm originally from Chicago, Minnesota. And get excited, and now all of a sudden we're clinical, and it does put Lyme up higher on the radar again.
Yeah, a dog that visited Minnesota a year and a half ago for a camping trip, that could have been a significant exposure, and now it's in back home in Florida. And if we don't know that that travel history happened, then that might not even be on our radar as when we work it up. Now, I say, most of the time Lyme disease is a good infection to treat because it makes you look good. The dogs respond to treatment usually pretty quickly. That's true until it isn't. And there's one manifestation of Lyme that is the one that I hate. I mean, when we talk about Lyme disease, I get excited, except for this aspect of it, and then I get really, really sad. This is Lyme nephropathy.
Sure.
So, what happens with Lyme nephropathy is in some dogs, and we are not good at predicting which dog this might be an outcome, which dog it won't. In some dogs, that chronic inflammation goes down a different path. And instead of the kind of classic inflammatory of the joints and that type of thing, these dogs have side effects in their kidneys. They develop a glomerulonephropathy that's not caused by the bacteria living in the kidneys. It's not lepto. Okay. It is antibody complexes. So they have this unhealthy immune response that leads to antibody chunks getting clogged up in the glomeruli until you go into a glomerulonephritis, and these dogs present much differently. Now, in my experience, I've seen a handful of these cases over my career, and really horrible. They're really horrible because
Hmm.
they tend to be retrievers. For whatever
Hmm.
reason, retrieve and I don't know if that's just a population thing because we got a lot of retrievers in the upper Midwest, or there's some type of predisposition. No idea because we can't predict it. We don't know the pathway that this happens, but they tend to be retrievers. They tend to be young or middle-aged. So they're dogs that shouldn't be at an end-stage chronic disease, and they tend to respond very poorly to treatment. And in these dogs, I've never had one that lived.
Right. Same.
And they come in, they're skin and bones. It's been a chronic manifestation, slow onset. And these dogs, at least in my experience, the ones I've managed, almost none of them have ever had a history of classic Lyme infection, the
Hmm.
classic swollen joints, things like that. And in my experience, these are dogs that do not have a good history of protection. They're not on consistent tick control, and they have not been vaccinated previously. So that's kind of the downside. If you're living in a Lyme endemic area, you've seen it, you've seen what it does, and you never want to see it again.
Hmm. And even not in a Lyme endemic area, I've diagnosed Lyme nephropathy, and that's it's like, I don't know, my shoulders just drop and like I just get so sad when I have to go have that conversation with an owner of one of these dogs because I agree, it can be really devastating. And similarly, I probably haven't seen nearly as many cases as you have, but the couple that I've seen, they tend to get really sick, and it's devastating.
Yeah, it's a very sad thing. And so I guess my takeaways from this is two things. Is number one, for utility for a practitioner, number one, you want to be strong in your prevention game.
Hmm.
If I'm, tick control just across the board is critical for any dog in the United States. But I think if you're living in a Lyme endemic area, I think vaccines should be part of the story too. And in fact, I think in Lyme endemic areas, they should be a core of dogs. Why not vaccinate for it? Why not build protection for it? I just don't understand why you would withhold that if we have effective tools available.
Sure, absolutely. As I was listening to you talk about Lyme nephropathy, I went, gosh, it just, sometimes you feel like you're like shouting tick control from the rooftops, and it can be so disheartening if we have pet owners who are pushing back and don't believe in tick control, don't want to do tick control, because then we see what can be these really devastating effects of tick-borne diseases, and like we've talked about how clever they are at evading detection until it's a problem. And even in those cases where they get sick and you start antibiotics and then they get better, like it's not a fun 48 hours. Like everybody's a little nervous for that whole 48 hours leading up to, okay, now they're starting to take a turn and get better. Kind of along the lines of talking to pet owners about tick control measures, whether it's oral preventatives or vaccinations and things like this. You mentioned being in Ohio and there not being it not necessarily being Lyme endemic, and watching the geography of Lyme disease change over time. And we've touched on this a little bit with it not really liking the Florida heat. But as a big picture, how has the geography of Lyme disease changed over time?
If you're a tick, you're loving it. We have a perfect storm of factors converging. Number one is we have warming temperature trends. So areas where you are on the border, and this is across the this is across the board. This is ticks in general. Ticks are expanding into areas where they haven't been. New species, new types, new population numbers. So we have temperature trends that's favoring spread. We also have wildlife trends that's favoring spread. White-tailed deer. White-tailed deer are critical for reproduction of adult ticks. If you have an area and you have ticks and you really want to up those numbers of ticks, make sure you have a healthy white-tailed deer herd because they're in there and they're going to upregulate the number of mating ticks and the number of eggs that get put in the environment. Again, this is across the board with multiple species, including exotic species. Third thing is change in forestry patterns. The way we're living, the way we're planting trees, the way humans are expanding and how we're expanding it, we're creating perfect environments and microenvironments that favor those exotic ticks and other species of ticks too. So we're really getting good at having lots of white-tailed deer converging with animal populations. And it's not just a white-tailed deer question. We have other animal species expanding. Migratory waterfowl, we have turkeys, we have all sorts of things that are expanding in the United States. They're bringing ticks with them, and we're coming into environments that now favor those ticks. So there's definitely a big geographic expansion of this infection that just seems to be marching out. Now, the tools that we have to mitigate that and to be in front of it, we've got two things I think are critical for any practitioner. Number one, I think you should incorporate screening. I think that's a great idea. Those in-clinic tests are combined with heartworm, so you can do a parasite screen instead of just doing a narrow, a la carte thing, and that'll give you an idea what's relevant in your practice. The other thing I think you need to do if you're going to incorporate screening is you need to have a strategy. Okay, what happens when I see a positive test? And the reason this is important, Cassie, is we know that most of those positive tests will be with asymptomatic dogs. So we're going to have that conversation with the owner of now, what does this mean?
Hmm.
And two, we're going to have a strategy in our mind of, especially if the Lyme turns positive, I know that there's a subclinical infection in that dog. What do I do about it? And I think doing nothing is not a good idea. I think you have to have some protocol where you're either monitoring or you're doing something. So that way, if we need to intervene, we can intervene before we get something like nephropathy.
Do you want to talk about like where we go next in terms of diagnostics and treatment?
Sure.
Okay, all right, perfect.
This is okay, Cassie, if you want to get people fired up, what you do is you take like a handful of people to practice in a Lyme endemic area. Maybe if you're really evil, you'll throw in some internists. You'll throw in some of the College of Veterinary Internal Medicine into this group. And then you say, what's the right protocol for a Lyme positive asymptomatic dog? And I'm going to tell you two things. Number one, you're not going to get an answer. You're going to get answers.
It's it's so funny as I've been listening to you talk about this, like when you were like, if we get stressed, then this happens. I'm like, oh, it's the Addison's disease of tick-borne disease, and then now you're saying, we put people in a room and you're going to get all these different. I'm like, oh, it's the mast cell tumor of this disease. Like this. I think it just speaks to like how adaptable and just hard to pin down this bacteria and this disease is.
Yeah, so you're going to get an answer. So the first thing, you're not going to get an answer. You're going to get probably if you got six people in a room, you're probably going to get seven different answers. And the other thing that you're going to get is everyone's right.
I was going to say, and strong opinions on this.
Convinced, them's fighting words. And so and this is reflected if you look at the American College of Veterinary Internal Medicine, their Lyme consensus statement, the most recent. It was kind of fun. I don't think it's a consensus statement at all because when you get into prevention strategies, monitoring strategies, there's a lot of different opinions. And so basically, I'm not going. I want to give your audience a picture. I don't want to make this Matt's opinion. So here's the options you can go down. Number one option is there's quantitative antibody tests. So we can actually quantify what the level of antibody response is. Now, that doesn't predict who's going to get sick and who won't. So no matter what that antibody number is, because the tests we run in clinic are qualitative. There's a color changer, there's not. We just don't know how high, low, or medium it is. So you can run a quantitative, and that'll give you a number. Now that number doesn't predict disease, but that number can reflect how many immune complexes are circulating in that dog. We know a higher quantitative antibody level is associated with a greater number of immune complex circulation. The other thing that it's associated with, and again, these are based on laboratory studies, we don't have a clear definition, but the other thing it can be associated with is number of spirochetes in the system. So again, does that predict disease? No, but that's what that number tells us. So I think a quantitative antibody test is a very good thing if we're going to treat. The reason being, if I'm going to treat and I know that blue dot is going to stay positive for years, then next year when I run my screening test and the year after, it's probably going to be positive. How's that conversation going to look? And so one advantage of a quantitative test, especially if you're going to treat it, is you can know where you started. And so every time it's positive, then you can follow. And if that number is declining, that tells me valuable information. If the number goes sky high, that also tells me valuable information. So that's one option. Another option is urine protein screening. Because again, why would you screen for protein? Well, if you have kidney damage, sometimes protein loss in the kidneys is your first sign. So you're going to see a lot of people advocate a urine protein screen. The challenge with the urine protein screen is it's not specific. I mean, if you open up the textbook and say, hey, what gives me a positive urine protein? That's like pages.
Sure.
And it can range from, okay, irreversible nephropathy to you collected the pee in the morning.
Right.
So you really want to make sure we put that into context. And the other thing we don't know, Cassie, is if you're not peeing protein, at what point in the disease process do you start peeing protein before you go into nephropathy?
Sure.
Is
So
that
like by the
years?
time you detect it, are you already, behind?
And how often should we run that test?
Mm-hmm.
Is it yearly? 6 months? 4 months? There's no answer out there. So that's another alternative. A lot of people in Lyme endemic areas go right to a treatment protocol, even if they're asymptomatic. So you'll hear people advocating that. The reason they're advocating that is if I know there's viable bacteria, I'm going to go at them with one round of treatment. if I can, and I'm going to try to get in front of it so I'm not behind it. Um, and the problem is all of those have pluses, all of those have minuses. I did a survey project. I think 2018 for Elanco. It was pretty funny, Cassie. They gave me an intern. I had an intern, a student, a veterinary student that was doing an internship program with Elanco. We had her for a couple of weeks, and she was up in my area, and they said, "Are there any projects you want to do?" And you got no budget for it. So what do you? And I said, "What are veterinarians up here doing?" So I actually surveyed them. And I was asking them, hey, what do you do with the Lyme positive? And up in the upper Midwest, and these were clinics that we went into in Minnesota, Wisconsin, and Iowa. And what we found is the majority of the veterinarians in that area that I surveyed, the majority of those veterinarians would go on a round of treatment. They would treat off the bat. They would do one round of treatment. They wouldn't repeat the treatment every time they saw a blue dot, but they would do one round of treatment and then they would do some type of monitoring. So that's about 70% of the practitioners answered that's what they would do. Now, the other tools that they would use is quantitative antibody testing, and some would do urine screening. But the bottom line is everyone had a protocol that they plugged into. Very few people would just do nothing and just let it roll and hope for the best.
Sure. And I think that applies really across the board with tick-borne diseases because like you said, these antibody tests they tend to stay positive. So how are we going to handle that? What kind of screening are we going to recommend? And it sounds like there's pros and cons to, well, maybe not pros and cons is the way to put it, but an argument to be made for different types of strategies. I've listening to you talk about these quote unquote subclinical dogs where we know that they're antibody positive. I don't know. Listening to it, it seems like there's some merit to going ahead and doing a round of treatment if because you're like how subclinical are they if they have histologic evidence of inflammation? But I can again, I can see the multiple different arguments that can be made for different strategies.
And that's where it gets really interesting because you're absolutely right. It's an argument, and certainly antibiotic treatment is a privilege that we have in medicine. It is
Hmm.
not a right. And with the stress that we have with antimicrobial resistance, we certainly want to be very judicious. However, there's a lot of moving parts to this. My best advice, and again, without giving you Matt's, opinion, I think if you're in a practice, what you got to do when we're screening is you got to get all the doctors together. You got to herd them cats. You got to sit down in a room and you got to hash it out. And I think the most important thing we can do is on a clinic by clinic level is if the doctors have an agreed upon
Hmm.
protocol, because that will simplify those client conversations, it will simplify staff training, and it will help reduce confusion. And I think that's really critical. And whatever protocol it is, they all have merits. Sit down, hash it out, reach out to people that you trust, the people that you feel are key opinion leaders, and get their advice. Read the consensus statements, those type of things, and hash it out. But I think one of the worst things we can do is if we have a six doctor practice or a three doctor practice, and we have six or three different protocols, that's going to be really confusing to our clients. It's going to be really confusing to our staff, and it's going to be inconsistent medicine.
Now I think it's the elevated ALP of tick-borne diseases. It's like,
Brilliant
what do you
analogy.
do about it? We don't really know. It depends.
You do
Uh,
stuff.
Yeah, you do stuff and exactly like you sit down and you have some kind of consensus on it. So everybody's giving the same message, but there's different arguments for different strategies. Um, so looking forward into the future, I guess in the present and into the future, that glimmering hope that we have. What tools do we currently have for prevention, and what do you foresee for the future of helping to protect against Lyme disease?
The dog that wins the Lyme game is the dog doesn't get infected in the first place.
Right.
So if we can focus our attentions on that, then having protocols and everything becomes less important because they'll never test positive if our tick control and our infection control is appropriate. So remember that 48-hour window for that outer surface protein coat involving OSPE deregulate, down regulating and going into that infectious form. That's our magic window because two things can happen in that chunk of time. Number one, if we kill the tick faster than that 24 to 4 hour window, we can prevent Lyme infection in the first place. And that's been well documented with fast acting tick control, that it is an effective tool at preventing Lyme infection by killing the tick before it can infect the dog. So that's the backbone of all what we're talking about is, hey, tick control. Now, from the Elanco aspect, we have two medications that have been evaluated as a strategy to prevent Lyme infection by killing the tick before it can infect them, and that's Credelio Quattro and Credelio Dog. Those are effective tools. So our tick control game, and there's other ones out there. Again, our tick control game has got to be good. But the problem with tick control is it only works if it's purchased, and it only works if it's purchased and given appropriately. So we have a lot of gaps in compliance. And so a way to fill that gap would be vaccination. Now, vaccines, basically what we're doing is we're cheating, Cassie. Cheating, telling the immune system which outer surface proteins they should direct and attack before that dog ever gets exposed to ticks. So vaccination strategies work best when we get that dog well vaccinated before it has a chance to go out and get it exposed to a lot of ticks. And the backbone of every Lyme vaccine is OspA antibodies. So OspA antibodies are a critical part of a vaccine because if we can kill every single one of those Lyme bacteria while it's still in the hindgut of the tick, they never have a chance to get in the dog. So you'll see there's different Lyme vaccines that you can choose from. All of them have a strong anti-OspA antibody component. Now, the downside of OspA antibodies is you get that window.
Mm-hmm.
You get that 24 to 48 hour window where that tick in the blood it's sucking up better have enough anti-OspA antibodies for every single Borrelia in it. Because once that bacteria downregulates OspA, those antibodies are worthless and it'll continue on. So a secondary strategy to synergize is to have multiple OSPs in your vaccine. Again, we're targeting OspA, but is there a benefit to having other targets in there? And there can be. There can be. If you look at rodent studies, you look at experimental vaccine studies with rodent models, multiple OSP vaccines have the potential to induce synergy. So again, we have this antibody going after this target, this antibody going after this target, this antibody going after this target. If you put them together, you're giving more opportunities to, perhaps kill, flag, weaken, do something to that Borrelia that flags the immune system. And so that's kind of where vaccine strategies and your differences between the vaccines are going to be what is, we all have OspA as our backbone, but are there other things that we can potentially add or not add to enhance it? So vaccination is a critical component too, and again, I'm a firm believer. If you're in an area where there's Lyme disease, you should have a vaccine strategy on deck, and there's a couple different ways you can get there. Now, one thing I will tell you, being from Elanco, our vaccine portfolio, our TrueCan Lyme, the one thing, and this is totally operational, the one thing that we offer that's unique is we have Lyme combination vaccines. So instead of having a single injection for the single prevention, what we can do is we can put multiple things in one injection. And I think this is really important for two reasons. First and foremost, there is a beautiful trend in veterinary medicine that has really was born and has really come to fruition during my career, and that's making the patient experience as good as possible. And I think about when I was a kid going to the dentist. That's a little bit different of an experience than my kids. So again, focusing on patient experience creates animals that are happier with their time in the vet clinic, and it creates staff morale. It's tough to be the bad guy all the time,
Oh,
Cassie. You
yeah.
know what that's like.
Yeah, and it just like I think of those appointments where, that you have the dog that has like maybe some warnings on there that's like just go slow, be cautious. They're nice, but they're nervous. And then, you go do that exam, vaccines, whatever you're doing, and the owner's like, "Oh, like they're acting so much better than they normally do." And it just makes my day. I get so excited.
Right? And owners that enjoy coming in instead of like,
Hmm.
oh shoot, just the
Right.
dog gets so stressed. And so, I mean, think about it. I mean, if we have three different things we're going to vaccinate them for, the dog's really happy the first shot, the second shot, it's thrilled with you. Boy, that third shot, it wants to be your best friend. No, no, and if we can incorporate that, and I think that tails very nicely with changes in vaccine protocol in veterinary medicine. For example, leptospirosis. You look at AHA recommendations, you look at the ACVIM guidelines, that is a core vaccine in their
Hmm.
opinion in the United States, and I agree with that. How do dogs get exposed to lepto? Well, they walk over an area where a wild animal took a leak. They get exposed to urine that has lepto in it. So it doesn't, the lepto doesn't come into your house and track you down. It's not respiratory. They have to walk across an area, put their nose down, and sniff where some wild animal urinated. It's literally that silly. Now, what's your risk factor for Lyme disease? Your risk factor for Lyme disease is you have to walk across an area where an exotic species tick is waiting for you to feed. Those ticks don't come into your house. They don't run you down in the woods. You have to walk over an area where a tick's waiting for you. Where do the ticks come from? Do they fall from trees? No, they fell off of a wild animal. So if you're walking where wild animals pee, you're also walking where wild animals shed ticks.
Hmm.
So I don't see if there's a dog at risk for Lyme disease in the United States, it's also at risk for lepto. And lepto being considered a core vaccine now, we have a Lyme lepto combination, which I love because again, maximizes the patient experience, maximizes your utility in your vaccine protocols, and allows you to plug in stuff and just make it easy. And so for those puppies that come into the practice, we have a distemper parvo Lyme lepto.
Oh, wow.
Three separate needle injections potentially in one. Boy, once you get used to using that, it's a good experience.
Sure. Yeah. Because, like you said, the more needle pokes, and then, there's, especially when you have like these little puppies, little not puppies, even like little dogs that are particularly, I mean, they're sensitive to the number of times that you're going to poke them with a needle, but also, volume and things like that that we're injecting into them, which, I know that's a whole nother conversation. So, yeah, the more we can minimize that and contribute to the patient experience from multiple different angles, the more beneficial it is. I have so many scenarios where I'm like running through my head of having to do more than one stick where, I would have preferred to just do one. Yeah, I love the idea of combination vaccines. And, I think it's really encouraging this, like you said, this vaccine portfolio, and the options that we have and the way that we're targeting different outer surface proteins. I was going to say antibodies, and try, and creating effective protocols to help protect these dogs against Lyme. Because, like you said, the dog who wins is the dog that never gets infected. So, as many tools as we can have in our toolbox. And so, I love the idea that we have these strategies currently to help protect dogs against Lyme disease. Do you see kind of continuously evolving, say, vaccine strategies or other prevention strategies to just help narrow this down, fine tune it, make it more and more safe over time for dogs in Lyme areas, Lyme endemic areas?
Absolutely. It comes down to two things. More knowledge. There's a lot of focus, a lot of research that will always give us more opportunities that we didn't think existed. And honing the tools. I mean, we know now that our tick control is so much better than it was 10 to 15 years ago. And now we know these
Amen.
tools have been demonstrated to play an important function. So getting more knowledge about how these tools prevent diseases is going to be pretty critical. The second thing is just our ability to manufacture and make vaccines as clean and as pure as possible and to really dial down on that messaging. And I would hope in the future we can develop more vaccines for other tick infections. We're not there yet. I don't know when that day's a coming, but boy, I'd love to see it.
Absolutely. Yeah. The more and more that we can do to protect against vector-borne disease, against tick-borne disease, because bringing it full circle back to where we started, ticks are very clever, parasites are very clever. These tick-borne, vector-borne diseases are, they're very clever. So the more strategies that we can have to help protect animals, in this case, protect dogs against these parasites, these diseases, the better. Dr. Eberts, always so much fun to talk to you. Like I said, I could have wrapped this up in the first 15 minutes with how much I learned, and we just continued, and the learning continued. And I feel like I'm walking away with, an even better understanding of Lyme disease and, kind of how it works and what our options are for treatment and prevention, and where this might go. I feel very equipped to go in and have this conversation with pet owners and make good clinical decisions. So thank you so much for joining me. Any final thoughts you want to share?
No, it's my pleasure. Again, if someone's not interested in this topic, this is probably a conversation they want to leap out the window or whatever, but it's so interesting, and I really appreciate the opportunity to chat with you. I love it.
Dr. Eberts, thank you again for joining me. So much fun to talk to you again. I learn so much every time I have the opportunity to sit down with you. So thank you so much for coming on the podcast. Big thank you to Elanco for making this episode possible. And of course, to everyone who tuned in, I hope you learned as much as I did. I got really excited about this one, so I hope you did too. Please leave us a 5-star review wherever you get your podcasts. It'll help other veterinary professionals like you find this and other great content we try to put out there. If you would like to hear more episodes, you can click on the Education tab on the VetFolio website or find us wherever you get your podcasts. Of course, I want to hear your thoughts on this talk. I want to hear ideas for topics you want to hear from us in the future. I promise when you do reach out with those ideas, we do everything we can to try to make them happen. So I'd love to hear from you. You can find me at dvm@vetfolio.com. We can connect on Facebook at Dr. Cassie DVM or on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day.